Want to go ahead? Do you want me to press it?
Yeah, let's go ahead.
Awesome. All right. We have a lot of people coming in right now. So for everyone that is coming in, if possible, can you guys turn off your camera and mute yourselves just for now? Just because we're trying to avoid the amount of people that have their cameras on all at once, because we know
It is wonderful to see all of your faces.
great
Thank
to
you
see
guys so much
everyone.
for
Yeah,
being here.
absolutely. But if possible, can you guys just turn off your cameras and mute yourselves for the time being, just so we can, we just want to avoid the craziness of having everyone's faces on the screen all at once. Thank you all so much. We appreciate that.
All right. Should we go ahead, Adam?
Yeah, absolutely.
All right. Hi, everyone. Thank you all so much for being here. We know that this is a really chaotic time, and so we're so excited to see you all. My name is Tarina Ahuja.
And my name's Adam Ashley.
And welcome to the Greater Good Initiative COVID-19 Zoom Town Hall. So before we get really into the actual town hall part of everything, we wanted to give you guys a bit of context as to how this all began. So essentially what happened is that Adam and I were on FaceTime, and it was like 3 a.m. at night, and we were FaceTiming just to talk, and we weren't thinking it was going to go down to politics and the pandemic, but you know, it did, because both of us are political nerds and we wanted to have a good conversation. And we got to talking about what we as young people could do. And thus came the idea for the Greater Good Initiative.
So the Greater Good Initiative is a youth-led policy think tank with a mission to create effective, sustainable, and nonpartisan policy and advocate it to local, state, and federal legislators. And so our first task as the Greater Good Initiative is to create policy that is going to tackle the coronavirus and the COVID-19 pandemic, specifically in the fields of education policy, economic policy, and public health policy.
So we want to go into a little bit of the purpose of this town hall. Essentially what that is to make sure that all ideas and all concerns are heard. Because as an organization, our goal is to eventually create thorough and thoughtful policies. And so in this time of chaos, in this time of that can often be scary, we're hoping that this town hall will be an outlet for us to share ideas and come together so we can do something to address the problem.
Just for the formatting of the town hall and just for how this is all going to roll down, I'm just going to share my screen real quick so you guys can see the agenda that I sent out on email. So right now we're in the introductions. Then after that, we have some policy officials and public office holders that we want to have a chance to speak for just a few minutes on the COVID-19 response in their respective areas of office. After that, we're going to move into an open forum where you all are going to have the opportunity to voice issues, concerns, and experiences that you've had during the COVID-19 pandemic. How you're going to do that is if you click in your Zoom call on the participants button and then use the raise hand feature, we're going to see those. And what we're going to do is we're going to allow you to share your camera and we're going to unmute you. And you're going to have the ability to just speak for a minute or two on, again, your issues, concerns, and experiences during the pandemic, just so we can get an idea of the different experiences, because it really does vary from place to place and just from person to person. The experience can be very different. After that, we're going to go into a brainstorm where we're going to come together and brainstorm some realistic policy solutions that we can use to address the COVID-19 pandemic. And then after that, just any final questions and comments, we can talk a little bit more about the Greater Good Initiative if you guys are interested. And then we're just going to close out.
Awesome. And so now we would like to move on to the introduction of our leadership team. We want to give these people a huge shout out because they are definitely the people that have brought the Greater Good Initiative to life. From everything you've seen on the social media, from initial brainstorming of policy to bringing this Zoom town hall to you, we have to hand so much of it to them.
So they're all on the call right now. Like we said, we're keeping cameras off just to avoid any confusion, but we do want to recognize them all by name because they're the people that have really been doing a lot of the work and making this all possible, inviting you all to come. And we would not be able to be as successful in holding this town hall without them. So our Director of Economic Policy is Jack Klein. Our Co-Directors of Education Policy are Heron So and Iona Volinets. Our Co-Directors of Public Health Policy are Olivia DiGiulio and Margot Matheson. Our co-directors of Strategic Planning and Public Outreach, who have been running our social media pages, are Grace Berry and Diana Fernandez. Our co-directors of Development are Joseph Kratz and Julia Masterman. Our co-directors of Local and State Advocacy are Coulter Adams and Jacob Ellis. And our co-directors of Federal Advocacy are Sophie Clinton and Elizabeth Paul.
All right. So we would now like to hand over the mic to some of the incredible, dedicated, and passionate public officials and policy experts who are here today. As you can all imagine, they're super busy right now trying to fight for their constituents. And so we are so lucky and honored to have them here. So without further ado, we would like to welcome Falls Church City Mayor David Tarter. Thank you so much for being with us, Mayor. We're going to go ahead and get your mic on.
There you go.
So thank you so much. It's a pleasure to be with you all today. I appreciate the opportunity to spend some time with you all and also your involvement in our greater community. I am the mayor of the City of Falls Church. As you imagine, we have been quite busy. There's a lot going on, but I would say first and foremost, health is the number one priority. Everything really starts and ends with public health and fact-based science and information. And so these past few weeks, we've tried to use that as our touchstone and our guide to the decisions and actions we've taken. And along those lines, I would, if I could, just by starting out, mention that young folks have a very important part to play in this. I've got 3 teenagers of my own, and I've heard often how this doesn't affect kids as much, that the health ramifications for teenagers and young people are really not the same as they are for other folks. And if I could, I'd just like to start by mentioning how important it is for younger folks to model and speak to good health behavior. Even though young folks are not as great a risk for actually getting very sick, they can be carriers. And so I would strongly encourage everyone on this call to practice all the health guidelines you've been told, and wear masks when you go out and other things like that you may not feel entirely comfortable with. It's not just for you, but it's for your parents, your grandparents, and all the other folks you might interact with. So just an opening plug for you all showing leadership within your own age cohort. But Falls Church is working actively on a number of fronts on this pandemic. A lot of things we've done have happened in the first couple of weeks. And so we were very busy, particularly with shutting things down, frankly, whether it's the library, community centers, all sorts of things got shut down fairly quick phase. We are working to ensure continuity of government, to make sure that the things that are important for folks, whether that's trash, whether it's effectively, and also planning for our recovery, which we are not ready to go back out yet, but that day will come. And so we're actively planning for the next phase of this pandemic, when we might be able to get back out. But to my mind, that's something that must be fact-based and science-based, not political. But when the experts tell us it's appropriate, that we can start taking some different actions. And then lastly, I would just note, this is going to have a tremendous economic impact on our city and on our region. And we've yet to really feel the full impacts of it. But we as a local government are right now struggling and starting to begin the difficult task of trying to figure out how we can make our budgets balance. And unlike the federal government, local governments really do need to make their budgets balance. And so that means some difficult choices that are going to be ahead for us, whether that's pay freezes, whether that's reducing services, raising taxes, cuts to important programs. We're in the midst of doing all that right now. So that's just kind of a little bit of an overview of what we're doing here on a local level, but I'd be delighted to take your questions as this meeting progresses. But thank you for giving me the opportunity to spend time with you today.
Thank you so much. We really appreciate it. Next, we're going to be hearing from Monsimran Kalon from the Prince William Soil and Water Conservation District Board of Supervisors.
Hello, everybody. Monsimran Singh Kalon here. I am joining from my vehicle because I want to give a bit of a explanation. And a time of quarantine, I'm not at home. The reason to that is daily we have been serving meals to underprivileged children seniors and disabled folks in DC, Woodbridge, and Manassas, Virginia. So I've been managing that, so I have to run between those locations. So therefore, I am not at home. Just wanted to give you guys a bit of an update. So a lot of people are wondering why I'm in conference calls and Zoom meetings while I'm in the car, especially during such time. I am serving right now as a director of the Soil and Water Conservation District here in Prince William County. And in a time of uncertainty, specific travesty, especially this being a global pandemic, I feel like our responses today are very centric to being Americans. And while that does describe our experience, it does describe who we are and where we are. I feel like it is a bit insensitive towards the nature of this pandemic being global. Our responses, especially personally, emotionally, family-wise, these responses have to be curtailed to a global audience, taking into consideration, this is a disease that is affecting people around the entire world and not just us. A lot of times we are very privileged in our conversations because we address the issue only as it concerns us, our families, or let's just say the 50-mile radius that we live in. So one of the main things that I just wanted to push out time and again with this is, yes, we have to take care of our immediate communities. We have to have a measured response medically with our hospitals. We have to quarantine. We have to isolate. But in the rhetoric and the way that we respond to these things, whether it's from the White House, whether it's from the governor's mansions, whether it's from the state legislatures, or down to county and city officials like you guys have here right now, the responses must be global. The responses must take into account and measure what is happening around the world.
Thank you so much.
All right, thank you so much. Next, we will be hearing from Mr. David Lanham, who's the Director of Communications at the Brookings Institute Metropolitan Policy Program. We are so excited to have you here.
Thanks. Appreciate the invite, and I can jump in with a few comments. It's great to already hear the diversity of thought and just the folks in the conversation here. So I can kind of just introduce a little bit of what I do. So I work at a think tank. I work at the Brookings Institution, and the program I work on, Metropolitan Policy Program, really what we do is we look at the economy, we look at all the different national issues, but we look at what the local economic realities are. So as we have an expert on housing, as we have infrastructure experts, emerging technology, automation, AI, you name it, we are looking at what the reality is in the DC metro area, in San Francisco Bay, Omaha, Nebraska, Midwest versus Southeast versus Southwest. So our job right now, overnight, 5 weeks ago, is we've shifted to doing real time and kind of medium and long-term economic analysis on what's going on here. So, I'll date myself in terms of, I graduated from college May 2008, which technically the Great Recession was already underway, but no one really knew that yet. That was that kind of May 2008, that kind of timeline. It wasn't until the fall where hundreds of thousands of jobs were being lost and the kind of stock market collapses. And so that was hundreds of thousands of jobs. Now we're in millions of jobs being lost, 22 million unemployment insurance claims over the last 3 weeks and last month. And so the historic nature, that we're seeing where every policy issue, every person and every policy issue is being impacted. So what we're kind of talking about and writing about in terms of there's stuff that needs to be addressed right now. Essential workers need support. They need beyond one check. They need hazard pay. Folks who are 3-hour commutes with lack of transportation and then kind of the risk that they're putting under need more support. So there's immediate stuff, but the way we're talking, what we're saying is that this is a once in a generation opportunity to fix some of these vital policy issues, address historic inequities, whether those are racial inequities, whether, whatever that is. This really is kind of a once in a generation opportunity. So we have to get it right. So I applaud the folks, you guys that are organizing this and the group itself, and talking to these folks, and to keep doing that. One of the things at Brookings, we have a cafeteria. Every day you walk in the cafeteria, you don't know who you're going to walk into, whether it's a local, national, international leader. We put on events, so we have a lot of kind of names come into the building. And people are willing to talk, whether you're reaching out on email, put some really good context, what you're reaching out to. You never know. There's a lot of the right leaders will want to talk to you, as you can see from even this conversation today. So I'm encouraged to hear, to see the organization on this call, and would just say, keep doing it, because you guys are going to bring a lot of the ideas to the forefront of the conversation.
Thank you so much. Thank you so much, Mr. Lanham. Next, we're going to hear from some public office holders and some officials in terms of education. So we're going to hear next from Dr. Peter Noonan, who is the Falls Church City Public Schools Superintendent. Thank you for being here, Dr. Noonan.
Thank you. It's my pleasure to be here with you today. And let me just preface my remarks with my appreciation, first of all, of everything that's already been said. And also with just a note of admiration. I think about my own experiences growing up and thinking about the work that you all are doing with respect to your policy advocacy, and thinking about the courage that it takes to go forward with some of the decision making that you will as an outgrowth of some of this work. And it takes courage. And I just want to say thanks for that courage. I'll say this, when it comes to policy decision making during a pandemic, it wasn't something I signed up for when I said I would be the superintendent of schools in the city of Falls Church, that's for sure. But there is that whole notion of all other duties as assigned. I would say that the thing I'm most, one of the things that I would say as you're thinking about your planning with respect to policy is that oftentimes you have to anticipate. You have to anticipate what the issues are going to be. You have to anticipate the impact of the issues and anticipate what the outcomes potentially can be. And we were fortunate enough in the city of Falls Church to have a really smart team of people that started to anticipate this pandemic way back at the end of February. And on March 6th, we had a retreat to begin planning what would it look like if we had to close our schools. And so we started doing that work on March 6th. And then when we ended up closing our schools, and that was one of the hardest policy decisions I think I've ever had to make, was closing school before the governor came out with his decision to close the schools in Virginia. We were able to start online instruction on March 17th. So we only had to go 5 days of down before our kids were back in online learning, both synchronously and asynchronously. And it's a real credit, I think, to the team of people that we have that all believe strongly in our community and in our kids. And I think that conviction of work and care for others really became a significant driver for us to be able to get up and running so quickly. But as you all think about your policy decision making and what you're going to advocate for and what you aren't, one of the things that I would add to this conversation, I suppose, is thinking about, what are the drivers and what are those aspects of decision making you've got to think about. So when we went through some of our early work, and still even today as we think about the policy that we're making with respect to education and the like for our families in the city of Falls Church, we have to begin with what is fair. We have to think about what is equitable, and equitable doesn't always mean equal, right? So there are different families that have different needs and the like. We need to be thoughtful about what makes sense. After all, we are in a global pandemic, so there are some things that simply don't make sense the way that we've done things in the past, and so we need to be reasonable and thoughtful about that. And then ultimately, what is in the best interest of our students and our families and our employees. And those kinds of decisions with respect to school decisions are multifaceted in the best of times, and even more multifaceted in a global pandemic. So thinking about those as our drivers, there's also this notion of what are the considerations that we have to pay attention to. And you heard some of them mentioned earlier, but just to add on to that is what are the family constellations that we have in our broader community? Not all families look the same. And so as a consequence, One decision that you make for one family isn't going to be the same for every other family. What if somebody is sick? So if we make a policy decision in education and family members are sick and students are taking care of their parents, or the students are sick, then we have to be thoughtful about that. What if a family doesn't have means? You know, we went to an online solution because we were able to ensure that 100% of our kids have access. That was a policy decision that was made years ago that really led us to do some things that were very positive through this global pandemic. So those became sort of the drivers and the considerations for us as we began to move forward, which then sort of leads me to what were some of those decisions. And I'll just very quickly share them with a few of them with you just for your thoughts. But before I do, I think about, I don't know if there's any Hamilton fans out there, but I'm a big fan of Hamilton and science, right? So every action has an equal opposite reaction. So when we made the decision to close, we knew that there was going to be a reaction to that. There was going to be an equal and opposite reaction to figure out how to deal with it. How do we make sure that everybody in our community has food? Making sure that we had not only boxes of food for everyone in need, but our Ed Foundation gave us $50 gift cards so we could give to everybody. And so that was a policy decision that they made in combination with the school system. What does instruction look like? It doesn't look like it used to look like, that's for sure. And how do we make sure that we can award verified credits to our high school students and middle school students taking high school courses? How do we talk about grading in a fair and equitable way to make sure that we're moving the ball forward, if you will, with our students, but also knowing that some of our kids might be sick and can't access? How do we make sure our kids meet their graduation requirements and can go through some sort of graduation this year? That's really important to us. Other policy decisions around operations, how do we make sure that all of our staff get paid through this even when they're not working? So those were some of the things that we've been wrestling with. I think the exciting thing for us is that I think there are 3 phases of this to consider. The first is sort of the crisis and triage phase. The second is sort of a transition phase. And then the last is a post-pandemic phase. And I think we're beginning to move out of the triage and crisis phase now. We've got our systems are set, our policies, even though they're modifying slightly as we move forward, we're not in that crush of making decisions very quickly, like the mayor indicated in his opening remarks. And so now we can sort of settle into this a little bit and transition, and the work that you're doing to think about what are those policies around equity, fairness, and the like really can root in a very powerful way. So anyway, I'll stop there. I could talk for hours. Those of you that know me know that. So I'll stop there, but I do appreciate your work and have great admiration for all of you.
Thank you so much.
Thank you, Dr. Noonan. We're now going to hear from 2 school board members from the Fairfax County Public Schools School Board. First, Ms. Melanie Marin, who is the Hunter Mill District Representative, and then Ms. Abrar Omesh, who's one of the school board members at large. So Ms. Marin, if you'd like to go first, and then Ms. Omesh, you can add on if you'd like.
Hi, great, thank you. I am delighted to be here. Unfortunately, under these circumstances, not so much, but really delighted to see the energy. And if I were in high school right now, I'd like to think I'd be among you doing this. So I'm Melanie Marin with the Fairfax County School Board. I've been in office for about 4 months, but I'm no stranger to education and public policy, which I'll talk about in just a bit. But as a school board member, I represent the part of Fairfax County. If you go to Madison, South Lakes, Oakton, Herndon High School, I could be your school board member. But right now, if some of you are aware, we had a 5-hour school board meeting today to address distance learning and the budget. And I share those things because there's so many policy implications in just those 2 pieces of work that you as students who are experts in education, really, you are the end users right now, you have an opportunity to impact policy in that area and action in that area. So for instance, with distance learning, what's the technology access like and the platform? A big thing I'm concerned about that I've heard about is hate speech happening online and digital citizenship. What are policies around that and anti-racist policies and approaches? Some school districts actually have an anti-racism policy. We don't have that yet. That's something I'm working on that's come up during this COVID crisis. I will say mental health, which had been a big issue before COVID. Now we want to make sure that you all are going to be okay and that you know the things that you can do to stay healthy. There's policy around that and stress. Also things like grading policies. And then ultimately equity, which is a big word thrown around, but you can really see how the inequities are coming to bear, whether it's through food insecurity in communities, transit, ability to have health care. So I had started, my career thinking the federal government was the place to be as the macro level, but I'm here to tell you today, 20 years later, that you can make a really big impact in your community if you focus on this local level. And for Fairfax, being the 10th largest school district in the nation, is a tremendous opportunity to affect a lot of students and communities, and then also have that be a model. So I like to be future and forward thinking, but I will just stop here for a moment to say it's important to understand how we got here. And I think it's because of systems failures of public policy. I have been a public policy professional for 20 years. I got my master's in public policy from Duke University, and then went to work at the US Department of Education. And I'm seeing today the same things I saw missing in education systemically as I saw 20 years ago. So it's so critical that you are interested in public policy. And while I probably share your desire to do things quickly and move fast, not understanding how public policy works and having the systems not be strong is what leads to tremendous crises of today. And I see how things are bearing out the problems that have been under the surface, the inequities, the lack of access to resources, the racism. So I would say that it's so important for you to understand your local governance, know who's making the policies that are going to impact your daily life, and understand that if we don't invest in things over time, we're not going to be able to create the solutions. We heard the superintendent say years ago, a decision was made about technology. Well, that's happening now in Fairfax. And that's just where we're at. But I am pointing out more and more in conversations that we are where we are because of the investments that we made or didn't make. And we're going to face budget shortfalls now. And once again, we're going to have to choose. And I'm going to advocate that we don't choose it at the detriment of you all and our teachers, but please just know that it's important to have that grassroots and that desire to make things change, but please do look at public policy systemic failures, because that's where we can see a lot of change happen. So I'll put my email address in the chat as well, and I'm happy to hear from anyone at any time. Thank you.
Thank you so much.
And Ms. Omesh, do you have any points that you'd like to add on?
Whoops, 1 second. Yes, thank you so much. First of all, I want to commend you guys for this initiative. I'm a huge proponent of student efforts, and was a product of this, Fairfax County Public Schools myself, and took part in a number of student projects. So really proud of you guys for launching this and for the professionalism involved with it, and encourage you guys to certainly continue being in touch with us, as Melanie mentioned, because we hope to be accessible to you. A couple of thoughts. So Melanie mentioned some really important big picture considerations for us as we look at this, and similar to some thoughts shared before, no one really had signed up for this. 8 of our 12 board members are all new and started in January. And then, of course, we were hit with this. So it's an interesting place to be, of course, where the community ends up expecting everything of you. And you're kind of even figuring out the role and trying to see what you're even able to offer. Because certainly one of the biggest reality checks for me, and I'm sure some of my colleagues, is even how limited our own capacity is, or our own bandwidth, or not bandwidth, but ability to maneuver and make changes is, and how much slower things are in government and in public services. So there was definitely the funding piece that my colleague Melanie touched on, where it's a matter of where we invest our resources. And crises like this are stress tests on those systems to really kind of see what we prioritize and where things go. But in addition to that, is a challenge of not only navigating the difficulty, but being able to actually bring about the change we need when there are so many players involved, and different offices and departments and ways of getting things moving. So that's certainly been one of the biggest things that's come to my attention, and is unfortunately a hurdle. It's almost like you have multiple players, all with the same intentions, all desiring effectiveness and equitable and excellent outcomes for everyone. but because of the nature of legalities and policy processes and a number of, what we might call more casually, red tape or hoops and loops, in the process, ends up being more difficult. And the other piece that I, would encourage you guys to think of when you're thinking of policy broadly, and this crisis certainly bringing light to that, is the differences between, policy or whatever ideal is set and implementation. So one thing, Fairfax County Public Schools, 190,000 students of all sorts of diverse backgrounds. Almost a third of our school system is free and reduced meals, which is generally an indicator of, let's say not upper middle class. And the need is there. So as this starts to happen, you have some families that are pulling you to think, why aren't you teaching my kids? They're sitting at home and not doing anything. But at the same time, you realize the reality when it's a 12-person body, a 12-person board supervising the entire county of incredible diversity of need. Folks who don't have food because they relied on the school system for lunch and breakfast, or folks who don't have access to internet at home. So then, the school system having to distribute MiFi devices and whatnot to try to bridge those gaps. What about staff that don't have internet at home? So things that we otherwise wouldn't have considered, which are, a result of larger, more macro level policy failures. If you think of whether it's welfare or provision of basic resources or whatever it is on a national level or state level, end up trickling down and impacting situations like this in ways that are really unfortunate, right? So the rollout of schools of instruction for FCPS, for example, we weren't able to start that until several weeks later, because there was an implementation of the meals program and distributing technology, literally having staff go to schools to get the extra laptops from carts that were in the building to give them to families that don't have them. So, just similar thoughts in some regard to Melanie. The tension always, again, between policy and implementation, between equity, and access and whatnot for folks. Where do you strike the balance? Where do you focus? How can you assess things when you're not necessarily putting people on a level playing field, especially when it comes to things like grades, in an education, from an education standpoint. So there's a number of things to keep in mind. And then finally, who do you listen to and what do you pay the most attention to? In a time of crisis, you're really pressed to determine what your priorities are. So, is it the people who are sending you hundreds of emails that you listen to? The folks who are being the loudest, who have, some level of privilege and know how to be the loudest, or the people who you may not be hearing from at all? I mean, how do you strike that balance in a public policy role is always something you want to keep in mind, because I always like to think, for every one person who's coming to speak to us, there are 100 or more who don't even know to come forward. And people don't even know the basics of who the policymakers are, right? You always want to remember that in all of this, we're sitting here, you guys are obviously folks who are following these issues and interested in the policy side. But on the ground, what do people really know? Most people are freaking out. There's a crisis, maybe someone lost their job, a relative is sick, having to take care of the kids and juggle school and so many different things. So it's interesting how, being in part of our role is to break these things down and make them accessible to people as much as possible. And so if I can be helpful to any of you, please be in touch. I will also put my contact information in the chat box. We have a number of, student efforts today. Actually, at 7, we're going to be live with someone from the health department who's going to answer questions more specifically on that. And, Heron and Yona, who I think you mentioned are the education policy folks on your team. Of course, feel free to get in touch, be involved, and thank you for this opportunity. And I'm happy to answer questions or whatnot if you have them later.
Thank you so much. All of those views were super insightful. We now like to welcome Miss Mary Beth Connolly, who's the Falls Church City Vice Mayor and City Council member. Thank you so much for being with us.
Hi, everyone. Thanks for having me. I'm the third person you're hearing from today from the City of Falls Church, and I am very pleased to follow Mayor David Tarter and Superintendent Peter Noonan. They're the two people that I spent the most time with online of anyone in the last 4 weeks. And their leadership has been really impressive. So I think one of the most important things as we think about going forward is you have to make sure that the situations and the community that you have built is working, and that your leaders are good, and that your leaders are people who are really concerned with the greater good of the community. And both Dr. Noonan and Mayor Tarter have shown that in the community. So they have built up a lot of respect. So as we go into this time, this difficult time, people are willing to listen to them and understand and know that they have everyone's well-being at the top of their minds. I'm going to talk just a little bit differently because in my day job, when I'm not the vice mayor of Falls Church, I also work for Falls Church City Public Schools. And I'm the community outreach person, which means I work with schools and with the business community. And it's really important as we think about policies going forward, how is the small business community and the large business community being affected? And it's not just people losing their jobs, but it's these small businesses. So I sat in the Falls Church Chamber of Commerce board meeting this week. And all of the members there are people who own businesses and run large and small businesses. Some of them own pizza parlors, and some of them own large businesses that employ 200 people. And the sadness and grief of the people in that meeting was really shocking to me. I assumed that these were people who had everything together and they knew exactly what they were doing, and they didn't. And they really needed the support of other people. And they really needed to share how they were grieving, and they also needed to be able to look to the leadership and to each other to say, how can we set policy that's going to help our community bounce back? And it's really important in a small town like Falls Church, and also in Fairfax County, large and small places, the business community, you kind of sometimes take it for granted. And in my role, what I do is I work with businesses and schools and try to get people to see how important it is for the whole community to work together. And this is a situation now where people in the community that are school families can support businesses in ways that they hadn't thought of before. Because it's really important that when we come to the other side of it, as many businesses as possible are able to be there so that our community can continue to exist and be strong. One example is when this first started, there were some people who said, how can we get the businesses that have food and need to make money selling their food to connect with the families that need food? And how do we do that? So out in Middleburg, they've come up with a government solution where they are purchasing vouchers from small businesses, and then they're giving those vouchers to people in the community to go and eat there so that they're able to share money that way. In Falls Church, we weren't able to do it in that exact sense, but there were several community members who said, let's try this. And they came up with a fundraiser to sell t-shirts, and the money that they're raising from that t-shirt fundraiser is then going back, and they're purchasing gift cards at restaurants, and then they're distributing those to families that need food. So that's a way where people can take action to be able to enact something that's happening. So again, I really appreciate being here, and thank you for all that you're doing.
Thank you so much. We would now like to welcome Delegate Jason Miaris, who represents the 82nd District of Virginia in our House of Delegates. Thank you so much for being with us in your busy schedule.
Thank you. It's great to be here and be on. And I know this is something that none of us ever expected to have to go through or live through or see. I like to refer to this as the first planned government forced recession in U.S. history, because of essentially what we have done is we have pushed pause on a $23 trillion economy. And I think the impact on that is going to be devastating. It's been talked to a little bit about the impact on small business owners. 2/3 of all new jobs created in America every year are from small business owners. And they're often your neighbor. And the conversations that I have had with them is just gut wrenching, because the number of them that are going to have to, unfortunately, probably have to declare bankruptcy. So as a state official, you try to think about where we were. And I told my wife the other day, imagine your life, remember your life on March 1st, and then look at our life now on April 1st. And the Commonwealth of Virginia is utterly transformed. we've gone from 3.8% unemployment, which was some of the lowest that we've ever seen. That was national unemployment. Virginia, the unemployment rate was even lower. That most estimates I see is we're going to be over 20%, possibly 25%. 25% was the worst unemployment that we had dating back to the Great Depression. So I think what we should not have any illusions over from the state perspective is we're going to have a very long process to get back to where we were. I saw a report this morning that said that we are not going to get back to 2020 or 2019's unemployment rate probably until 2022 or 2023. So for young people that are going to be presumably entering the workforce out of high school or after college, this directly has an impact on what they're doing. And so at the state level, what we're seeing is because businesses have been hit so hard and that directly impacts our tax revenue and people being laid off, obviously. I mean, the point I've tried to make to people is we have two crises going on at the same time in America right now. We have a health crisis, and then we have an economic crisis. And the economic crisis is one that the byproduct of that, which is for every point increase that we have in unemployment, the trickle effect, the impact of that in our communities is just devastating, from an increase in drug and opioid addictions and overdoses to suicide to depression. If you've ever had anybody who's ever struggled with substance abuse, you know the worst thing for them is to be idle. And so I have deep concerns what's going to happen to our communities for those that have struggled with addiction long term. We are going back in the General Assembly later this year because unlike the federal government, which even heading into this year borrows about 40 to 45 cents of every dollar the federal government spent is borrowed money, and that's been that way for the last 10 years. That's not new. That's before where we are right now, where at the state level, we have to balance our budget every year. And we've consistently, I think, been seen as one of the better managed states in the country. We're not Illinois. We're not some of these other states that have huge debt bombs that have occurred. But what has happened is when you've had this devastation that has affected the business community and so many people that have been hurt by this and laid off, that means a collapse in revenue. Why does that mean? The people that everybody's on the call means less money back to our localities as well. So the impact on this is through every corner of the Commonwealth. And so we're going to have to go back and try to readjust a budget that suddenly, when we passed the budget, when the General Assembly passed their budget in March of this year, they based it on tax revenues that were estimated in December when a booming economy. Well, that's utterly collapsed. So a lot of initiatives that passed are basically to be put on the back burner as we try to dig our ways out. So the point I make to people is you're going to have to create a bottom-up economy and look at what are those barriers of entries we've created for those small business entrepreneurs, which back in my own area, Virginia Beach, well north of 90-95% of private sector employers are small business owners. How are you going to remove those barriers of entry so they can say those three very important words, which is you are hired? How are we going to get the economy moving again? And we're going to have to look at those policies that make it easier, not harder, for people to actually engage and retain and employ people. Because my deep concern is this is not going to be, likely will not be a V-shaped recovery, in the sense that we can push anybody who has been foolish enough. And I've seen some people that have been foolish enough on TV and others to say, well, we'll press pause and we'll have a V-neck economy. Anybody who's ever a V-neck recovery on the line, when you go down and immediately go back up, they've never talked to a small business owner that are oftentimes the first person to show up in the morning, they're the last to leave. I talked to a small business owner this week who has a line of credit on his house. He opened up he started a small family restaurant. He opened up a second one. The bank required his house as collateral, and now he's facing complete economic ruin because we've essentially, as I said, a government mandated recession. So it's going to be a really difficult thing to walk through. I think it's going to create a lot of outside of the box thinking. I think it's going to, I don't think partisanship has any place in how we try to find solutions as we move forward. I think that would be a foolish thing to do. I think Richmond largely does not operate the same way Washington, D.C. does. I think Washington, D.C. is, I think we can all acknowledge, is a pretty dysfunctional place as far as from a governing perspective. I think the best thing I could say about the General Assembly is we're citizen legislators. Like, we go up, it's part-time, we do it for 60 days, and then we come home. And it gives us a really good perspective of living amongst our friends and business owners, and our kids are in our local schools, and it gives us a great perspective. But it is not going to be, it's not going to be an easy solution to all of this. We're going to have to make some really hard decisions as we're balancing both the health crisis and the economic crisis and how we're going to move forward, because a booming economy that's working for everyone, quite frankly, means we have the tax revenues to do a lot of the things we want to try to do for our schools and for our roads and for substance abuse and mental health areas. And a lot of that has been really cramped because of where we are, and finding the way out is going to require a lot of thinking and collaboration from people. So I appreciate being part of the discussion, and I appreciate you having me on. It's been an honor.
Thank you so much. Thank you so much, Delegate Miyares. The last of our speakers that we're going to be hearing from are Mr. Ben Loyola, who is a candidate for the Virginia 2nd Congressional District, and he's just going to speak for a moment on being on the campaign trail and what his campaign has been doing in response to COVID. Thank you for being here, Mr. Loyola.
Thank you for having me. Am I coming through okay? Good,
Yes.
Great. Well, yes, running the 2nd Congressional District, and I appreciate the opportunity to share. I appreciate you getting a message together. We've obviously been using this media to go out and meet with the constituents and talk with the constituents, town halls, virtual town halls, and your organization. So many are using this and leveraging this technology that we're very fortunate to have the ability to. I will add on and support what Delegate Miyares was sharing, is that strong, prosperous economy is paramount. Obviously, our education, and I'm a product of the public school system, is there because of the revenue base, allows us the options to ensure and do best we can to ensure great teachers and great schooling and great education for our children, my children included. But it starts with a strong economy, and fortunately, because we were leading in global economy and leading in America here with that, we should be able to recover faster than other unfortunate countries that either their policies or their governance don't have them in a strong position. As a result, they're going to suffer more. We look forward to, once we resume and get back and learn from this pandemic and come out stronger, to be able to go out and reach. I always say you can't take care of yourself. You can't take care of others if you can't take care of yourself, and that's so true. And then another saying is, a rising tide raises all ships. So with that strong economy, we'll be able to do all the important things, all the necessary things that we'd like to do as parents, as educators, as leaders in the community. My business, I'm an engineering firm. We quickly retooled and trying to leverage some of our 3D printers and printing up face shields, helping out to the local hospitals here. And we just delivered our first batch yesterday over to Centera, trying to help out where we can, and shared that information with other folks that might have 3D printers at home, a technology that normally would be reserved for factories and stuff. And now, actually hobbyists can have that technology. I donated a 3D printer to a local school in the area, part of their STEM program, and participating. So it's neat, and we're blessed to live in one of the greatest countries in the world and have a strong economy and a workforce and an educated workforce, and so many resources too, to be able to provide for ourselves and for others, for our community. The campaign, obviously, because of the social distancing, we've gone virtual, we've gone online, and to get our message out there, and we'll continue to do that. But I look forward to continue to work hard and become the next representative congressman here for Virginia's 2nd Congressional District, and bring my education of 30 years of military service, success in small business, a wonderful family, and just bring those up to DC. I will share that preparedness. It's very easy in a very prosperous economy to live day by day and not realize that you have to prepare. That's instilled in you, obviously, in the military, but also in my business and in my household, is to just have some reserves, have some capability. The schools have reacted quickly, obviously through teaching online, to be leveraging our technology to teach. So we have to plan. We always have to have plan A and plan B and plan C. And that's kind of my background, my upbringing. And we need to ensure one of the lessons learned is being better prepared for crises in the future at the local, state, and federal levels as well. And to be able to do that, to be able to prepare is number one, we have to take care of the presence. So you can actually put aside a certain part of our revenue through the tax base to have those resources available in the future. Because if you just say, live today, don't worry about tomorrow, and then something happens tomorrow, like it's happened right now, and then it's like, government, help me out, and then you see the response. You can't have a finite, limited resources support an infinite number of people, near infinite number of people at the same time. It just can't happen, no matter how much money or how much resources. So all of us at the most individual level have to prepare for ourselves, and then work that out from the local level, the school level, at state level, and work it up, because the need is great. And I feel for the individuals. I was pleased to see the multifaceted approach that the federal government's come out with the 3 phases there, with the CARES Act and the Families First, as well as the Corona response package there. That's kind of like trifecta effort of coming out of immediately injecting money, which now is coming into the individuals so they can take care of the present. They are injecting money through the unemployment and supplementing the state unemployment with no waiting period. So as well as supporting businesses with the paycheck protection program, to allow the payroll protection program to allow that money to come in and keep the folks on the payroll to prepare, as well as to be able to operate if necessary, but also prepare. So when we're able to get back to work and everybody's going back to school and education, we can come back stronger and quicker. And I believe that that 3-phase approach, as well as just the wonderful people and hearts and minds of Americans across the country, are what's going to allow us to recover from this very quickly. We've lost, sadly, too many folks. As a matter of fact, my wife's a friend in her quartet lost her mom 2 nights ago, and her dad's also in critical care because of the coronavirus. So it's hitting close to loved ones and friends, and our children are impacted. Obviously, they're concerned about what they're hearing and seeing, and we just got to support them. So, but we have to be able to take care of ourselves first. Our policies in the future have to prepare for the best desires, best goals, best plans, but also for what if. You've got to have those what if plans that actually make us better in the future, because we just don't know. There's no guarantees in life, and preparedness is very important. So thank you for the opportunity. Thank you for sharing. Again, Ben Loyola. Anybody wants to read more about myself, it's benloyola.com, like the school, LOYOLA. And I appreciate your support. I look forward to working hard and representing us up in Congress. Thank you very much.
Thank you so much, Mr. Loyola. We will definitely take that message of preparedness to heart. So thank you so much to all of our public officials who have been, and people running for Congress, as well as policy experts, for all being with us here today. It has meant so much. It's been an honor to hear from you. We would now at this moment like to open the floor to any of our attendees. And for this part, we would really like to hear your thoughts and concerns, things that you've been seeing as issues that you haven't heard about in the news, anything that you'd like to say, we want to hear. So please feel free at this moment to use the raise your hand feature on Zoom, as well as start typing things in the chat. We will make sure to get you heard. And we already have somebody raising their hand. Helena will get you on.
Hardy, let me unmute you.
Hello, can you guys see me?
Yes. There we go.
Okay, awesome. Hey guys, my name is Helena Hardy. I go to Woodson and I'm friends with Adam. And so something that's really struck me through this whole pandemic is the uncertainty of it all. And I think that that's what's hardest for people around me and Americans, because I think that in past, when we have sort of a wartime effort like this, we have something that we can rally around. But in this area, I feel like people don't really know what they're supposed to be doing. And so something that I found interesting is that when the governors have been setting timelines for when we're going to be ending restrictions and things like that, it's really been sort of arbitrary dates such as June 10th. And of course, we're all doing our best to try and understand, because it's an evolving situation. But something that I've been interested in is focusing more on research and metrics. And so instead of just setting times that we're going to end certain things, focusing more on researching different phases and different metrics. So saying that by phase 1, we can start opening up businesses again, and we need to go down by 5% in new coronavirus cases each day. or something like that. And I know that people are working
Hey,
tirelessly
Jason
to go and
Benuel, how are you?
figure that all out.
Oh,
But
good. Just got off of
so
another virtual town
that's
hall
what I've
with
been
the.
trying to think of, is focusing on different metrics versus just timelines, and then also going through where getting those steps and phases about what is life going to look like in the fall, and giving people something to rally around and sort of come together in times, because it seems like we're all, even though we're apart, we need something to all focus on. And I think that if you give Americans and Fairfax County citizens and Virginians something to look forward to, they're going to come together and do it. So that's what I've been thinking.
Thank you so much. That was incredible.
Does anyone else have a issue or concern or anything that they would like to raise their hand on Simran? We will unmute you right now.
Yes. So, can everybody hear me? Yeah. So one of the concerns I have been, talking to my colleagues about, I've been talking to our board of supervisors here in Prince William County, and our board, the director of Soil and Water Board in Prince William County, is the need to not stop regulating. And this may sound like a partisan issue, but it's not. This is more of a regulatory thing. There are certain things that we first of all, let me preface this by saying that nobody could have predicted this. We all have seen the pictographs that depict a pandemic in 1720 and then 1920. And then now, and saying, oh, this happens every 100 years. And while that may be true, and there are many scientists that have verified that, but regardless, yes, we could not have prevented this, and yet, but at the same time, we do need to realize there were intelligence reports that told us that this could have happened, that this is going to happen back in November. We knew this existed before the New Year's. We also knew this existed in January. I remember having these conversations at home, about a disease that has started its, infection in China. And that conversation didn't elevate itself to a national conversation until mid-March. And I want to say that it could have. If we weren't scared of public panic, if public officials would be the leaders that we need them to be. They are representatives. We are representatives, but we also are leaders. Just like you guys have started this initiative at this level, coming out of high school, going to college now, you guys have done far more than is expected of you guys, and I congratulate you there. But there are those of us who are not even doing enough that is expected, especially when we're elected officials. Partisan things such as deregulation or, making it easy to revamp the economy. Just, a personal point of privilege from my side, I think the conversation far too often gets diluted when we preface the economy or prefer the economy over human lives. And those who are not directly affected, like myself or many here, who aren't directly affected in terms of, the actual virus, and we don't know people who are, we often think that this is something that's occurring on a different planet, and it's not going to happen to us. It's not going to happen to people around us. Far too often when we think about those things, and then we don't take action. You see people in different capitals around the country right now. Here in Richmond, you see it in Lansing, Michigan, who are demanding the reopening of the economy. But we're not, they're not realizing that it's not just about one or two people that they know. It's not about the 100 or 1,000 or maybe even 10,000 populated communities. It's about the millions. It's about, more than 200,000 people that have been infected by this in this country. They don't, bring it back to math. Exponentially is how this multiplies. It doesn't multiply by 2 or 3. It multiplies by itself. And those are the kind of things that we have to keep in mind when we're writing policy. One of the ideas that I want to bring up sort of through this venue is definitely something that I brought up back in 2016 and 17 when I ran for House of Delegates here in Prince William County, is telecommute work. There is no reason in the 21st century, we're approaching the second decade of it now, we are in the second decade of it, there's no reason for the entire federal government to be conglomerated within a 4-mile radius in DC. There's no reason for financial firms to be conglomerated, whether it's Tyson Corner, whether it's Arlington, whether it's New York. And we've seen that with that hotspot in New York, when real estate is inflated, when the importance of real estate is inflated within a certain region, right? You have people living literally on top of one another, people's entire homes encompassing under 1,000 square feet. And you basically increase the chances of such a thing to be catastrophied. So I think one thing we can learn from here is to not let real estate reach a value point where people living, on top of one another is allowed. The second thing is not to allow, whether it's large firms, corporations, or it's government, to conglomerate into one small area and demand that everybody who works for them commute there. We've learned in this time that far too many jobs that could have been telecommute work, we could have solved our traffic problems, we could have solved our infrastructure problems by just working from home, right? And we've also realized that those people that we didn't recognize as heroes are heroes. Truck drivers, grocery workers, nurses, doctors, folks in that vicinity who aren't paid enough. It brings us back to that minimum wage conversation, a living wage conversation, right? Folks who we can't live without today, we can't live without grocery workers, we can't live without truck drivers, and we aren't paying them enough when you look at the past. So I think these are things to learn from this pandemic. And we need to make sure that we make a bullet point conversation and say, these are the things that we've learned from this. These are the things that we knew before. And this is how we're going to move forward. We're going to incorporate all of this knowledge that we've gained from this pandemic into future legislation.
Thank you so much. We will now be hearing from Aaron. All right, go ahead.
Hi, name's Aaron. I go to Virginia Tech, and I'm a friend of Joe Kratz. And my question revolved around the economic impacts of this lockdown. Now, the federal government, as we all know, came up with the CARE Act to provide $2 trillion to consumers and also to businesses. Now, since $1 trillion of that is going to the consumers and local government, and $1 trillion of it to businesses, is this enough to really permit the firms and the consumers in our economy to weather the storm, and also for them to survive the kind of reboot that occurs a couple of months later?
In my opinion, no. I mean, the best report I saw is at least 20 to 25% of businesses are going to fail in the country in the current economic conditions. And when I talk about my concern about where we are economically, that's my concern about lives. As I pointed, for every 1 to 2 point increase that you have of unemployment, the resulting result of deaths from addiction, from suicide, from depression. And part of the problem we have as elected officials is determining the capacity issue of how we're going to balance both crises, because both are going to end up with, unfortunately, a lot of our fellow countrymen dying or relapsing or suffering through horrible. Social isolation is one of the single most damaging things you could do to someone's mental health. And for our seniors, that's essentially what we've done. And we have to realize that there is a huge cost that we're going to have to work through on all this. At the heart of this, in my opinion, it's a capacity issue from the healthcare crisis. I mean, the question I constantly ask of our healthcare professionals is, what's our ICU capacity? Because that's why we are where we are, is because we've been terrified of the images we've seen in Italy and some other countries where they've just been overwhelmed. And so that's the main question I always want to know, is how are we raising our medical capacities? Our hospitals have largely answered the bell and have done a good job on that. But I don't think what we have done economically, the $350 billion that was put in place for the paycheck fairness or the paycheck protection area to try to keep employers so they cannot lay people off, that money is already exhausted. And so they're either going to have to put more money in, or they're going to have to think of a new program. And I think we're really going to have to really evaluate where we are as a country as far as how we're going to try to prop up our economy, because unfortunately, I don't think they've already run out of money, so we're going to have to attack that at the federal level. At the state level, we're going to try to do what we can at the state level, but it's going to require a federal response. And right now, I think it's too early to tell whether, in my opinion, what they've done so far isn't going to be effective for where we are as a country.
Thank you. And Aaron, for a couple of people had asked if you could repeat your question, so I'm going to unmute you. Would you mind repeating the question that you had asked initially?
Yeah. My question was, is the 1 trillion to consumers and the 1 trillion to businesses and corporations enough to help the economy both weather the storm and also reboot when we all can exit lockdown?
Thank you. And I think Delegate Miyares hit very well on that. I'm going to go to the next person. Just for the interest of time, everyone, can we keep our comments to 1 to 2 minutes, just because we want to make sure there's a lot of people with their hands raised. We want to make sure everyone gets heard. So we're going to hear from Pranav now.
Yes, we will get to all of you who have raised your hand. Thank you so much.
Hi, I'm Pranav, and I'm a sophomore at Langley High School. So, as Delegate Miyares mentioned earlier, Virginia's legislature is treated as part-time, which means lawmakers are really only able to actively work on legislation for about 2 months out of the year. And so my question is, how does the General Assembly work to address issues that are of significant importance and that are very time sensitive when it's only structured to operate 2 months out of the year, and especially when the General Assembly is not in session? Although the governor can do a lot, there is a lot that requires the power of the General Assembly, especially related to budget allocation during this time of crisis.
I'll answer that real quick. The governor is allowed to call us back into session at any time. And usually what we do is it's usually a shorter time period. And so we anticipate going back in later this session. But, Virginia consistently is ranked as one of the best run states at a state level in the country. So I think having a part-time legislator is helpful, because I think part of the problem in Washington is they kick the can down the road. And we know when we get up there for our General Assembly for regular order, we have 60 days to pass a budget, 60 days to deal with bills, and we can't just put it off. So I actually think it actually works out. We're going to go back later this year, probably for a couple days, to try to readjust the budget and pass some emergency legislation, but I think it works well.
Thank you so much. We will now be moving on to Ike. Sorry if I pronounced your name wrong.
My question is I recently watched an episode of 99% Invisible, which dealt with sort of the homeless population and sort of community's response to homelessness. And so are we doing enough to sort of help those on the streets and stuff, and what can we do to sort of keep them sheltered or improve their conditions during this time?
And do we have any of our public office holders or anyone that would like to speak on that briefly? If not, it can also be an open-ended question for anyone to respond to.
So this is Dave Tarter from Falls Church. I think it's a great question. It's a great challenge right now because it's a I don't know if can you hear me? Okay, great. It's a great question. It's extremely challenging. That population is often, non-compliant with health requests and issues like that. For example, our own health shelter, we had a homeless shelter that closed down because they weren't able to really deal with the health aspects of this. And so we're working regionally. I mean, that's one, I think, great thing that has come out of this is extremely strong cooperation within the region to try to address issues like this. The whole region is working together through an organization called the Northern Virginia Regional Commission at the present time. But it is a challenge. I'm not sure we've got great answers for this. We certainly want to get as much assistance as we can. We are working, the question earlier was about, is it enough aid? And I think the answer is absolutely not. Local governments in particular are going to have tremendous burdens put on them as it relates to not just homelessness, but all sorts of different issues. Our revenues are dropping dramatically. So I guess the short answer is it's extremely challenging. I'm not sure I have a great answer. Faith-based groups are also heavily involved and they're working. And that's why I think as a community, we just need to band together and find solutions where they are.
Thank you so much. Next, we will be hearing from Sydney.
Hi, so in relation to some of these marginalized communities that we're talking about, I was struck by the statistic or by the statement that domestic abuse cases would actually increase because quarantine allows abusers more access to their victims. And so I would just like to make sure that in this policy we include those voices and those narratives that I personally haven't heard a lot about in the news. And I don't know, this isn't exactly like a question, but just more of that's something that I would like to be included. And then maybe if there has been policy that addresses this, if you would mind naming those bills, if such a policy exists. Thank you.
Thank you so much.
I can actually address that. I don't know if you guys wanted us to.
Yeah,
but
go ahead.
Yeah, the county is actually paying close attention to this because you're absolutely right. There are reports on a national level, but certainly reason to believe that this is an issue. So, mental health wise, I know Artemis House, for example, has been a shelter for some folks who have had challenges and is currently accepting people, at least the last time I was, informed. I would double check that. But so those are some of the, there are resources that are put out there. I would highly recommend looking out to the county government, the website where they have some of the domestic violence resources, and they particularly pushed out some materials in the wake of COVID for the reasons you've mentioned. So it's very sharp of you to mention. I'm glad you brought that up. And there, even more broadly, mental health wise, I was trying to pull up, I had a list of resources here, but hopefully when I get it, I can post it in the chat to share with folks in general. But again, the best resource I was able to find so far has been Artemis House, if you know anyone affected, but it is something that county is trying to address.
Thank you. We're gonna hit all the hands up before 5:30. We're gonna do our best. We're gonna hear from Samaria next, and then we're gonna hear from Krishna.
Hi. Can you guys hear me?
Yes.
Yes.
So I'm Samaria. I go to Falls Church High School. So something that I've been kind of concerned about, and a group of people that I worry is overlooked during this time, are those with intellectual and developmental disabilities. For that group of people, school is more than just a place to learn. It obviously is a place to go and learn, but it's a chance for socialization that they may not have access to otherwise. And I know that at least within Fairfax County, there are opportunities for those students to learn job skills so that out in the world they are better able to acquire a job since it is so much harder for them. So the loss of school is really significant for everybody, but especially for those with intellectual and developmental disabilities. And I guess I'm just kind of wondering how at a school level at least we are making sure that we are giving that group of people the attention that they deserve.
Thank you so much, Samaria. We're going to hear now from Krishna. I'm going to unmute you.
Hello, my name is Krishna. I go to Chantilly High School. I was introduced to this organization by Heron Stowe. So a concern like I have about this is I've noticed how like the economic impact of COVID-19 is very similar to the Great Depression. So even though we start like, as many people have said, we focused on this issue like quite late. So that's like why we're in this mess so deep. So there is ways to get out of it. So if we like focus in on issues like combine short-term and long-term fiscal policy, focusing in on exponential fiscal policy, this can aid like in stabilizing our economy. By running this type of policy, you can help the unemployed get back to work because the fiscal policy affects the aggregate demand and the output in the job market. Thank you.
Thank you so much. We're going to hear now from Yukta, and then after Yukta, we'll hear from Rania.
Really quickly, we did have one participant that had to leave. Ashray wanted to give us a little bit of info.
Awesome.
Are you still on here?
Yeah, hi, can you guys hear me all right?
Yeah.
Yes.
So I just want to talk a little bit about a project I'm working on recently. It's called Hack the Pandemic. Hack the Pandemic is an initiative I helped start in Northern Virginia. And basically I'm working with local makers being people who can 3D print things or sew face masks. And I'm donating these collected equipments to local hospitals and first responders like police departments and firefighters. So what I was sort of looking for is, I was wondering if anyone knew of anyone or has it themselves, a 3D printer at home or a sewing machine that they could help make these personal protective equipment, and how we can sort of better market this project that I'm working on so we can find more people that can help out and contribute in donating to these places that are in need of this equipment right now.
Yeah, and before you hop off, feel free to put your contact information into the chat so that people can reach out to you if they do know people or they are a person that has access to these materials and this equipment to do that. That's really great. Thank you so much for sharing that.
Yeah, of course.
Thank you so much. We would love to start like thinking about partnerships and ways we can collaborate along those lines. Sydney, who had just asked a question, is going to put a link below to a fundraiser about domestic abuse and fundraising for a shelter in the area. Their goal is $2,000. Sure. They've made 1,300. So keep nice. Everything coming. Thank you guys.
Yeah.
So we're going to hear now from Yukta and then Rania, and then we will just keep on going.
Hi, I'm Yukta. I'm a sophomore at Chantilly, and I'm a friend of Heron's. And so I had a few quick comments. So the first is, obviously we try to implement online learning, but at the same time, online learning isn't exactly the same as sitting in a classroom and taking tests and listening to a teacher's lectures, especially with the technological problems that we've been facing recently. So I think it's important in the policy paper to include something about dealing with students' lapse in learning when they get back to school next year and helping facilitate their education, whether this be through counselor support or a slower pace or something along those lines. I also, in terms of easing back into the economy, I think once the situation subsides, obviously, that we promote entrepreneurship and invest in smart infrastructure and accelerate activities for which barriers might have been present before so that we can get back eventually to where we were in 2019, and also fund a lot into research and development and predictive modeling and analysis so that the next time a global crisis comes along, whether it be a pandemic or a humanitarian crisis, we can respond to it better. Thank you for this opportunity.
Thank you so much for sharing that with us. That was incredible.
We can now hear from Rania.
Everyone can hear me?
Yes.
So actually, after I kind of brought up my concern, I'm very concerned about the safety of our healthcare workers. I bet we all heard about how there's a shortage of face masks and ventilators. And I guess my question is there a way to connect people and companies who have or own 3D printers to create ventilators and masks on a global scale for hospitals in need? And then my second thing for Samara is, you talked about people with intellectual disabilities not being able to socialize because schools are over. We know we have the Best Buddies program at our school. Is there a way we could do kind of a Zoom party or chat thing to help with that issue?
To repeat the question, just because I know we had requests, if any of our public officials want to answer. Thank you so much for your questions. The first one, is there a way to connect businesses and corporations that are making these masks with hospitals and things like that? And I know Mr. Loyola had mentioned something in the comments. And then the second question was, is there a way to do something like a Zoom party, a get together to address things like connection and like students being able to get together?
Yeah.
So, sorry to interrupt, but I'd actually like to speak to that first question that Rania had. And it's that my organization, Hack the Pandemic, is actually, its whole purpose is to connect those local makers and those companies and people that can make face masks, face shields, things like that to the healthcare workers. So we've partnered with a lot of healthcare facilities and first responders in our area, like the Fairfax County Police Department and the Fairfax County Police of Animal Shelter, of animal control, and as well as the George Washington University Hospital and Innova Healthcare. So we partnered with a lot of different locations in our area that need this help. And we're also working with around 10 to 15 volunteers right now who are help making these face masks and face shields, but we're always looking for more. So please feel free to sign up on our website and email me if you have any questions about this. But Ronnie, that's exactly what I'm working on right now. Yeah.
Awesome. Thank you so much.
Next, we will have Alyssa. Are you still here? I know you said you had to go. I think you might have. Okay.
Yeah, I'm right here.
All right. Do you want to go ahead, and then we're going to go ahead and get Grace?
Yeah. So basically, my problem is my mom works at the local library. And an issue that she's been having is there have been a lot of people who are having difficulty connecting with the Virginia Unemployment Commission because because so many people are trying to use it, it keeps crashing, and the phone lines are kind of overrun with calls. So they're like on hold for several hours, and it's just not exactly a sustainable way to access the unemployment insurance or unemployment aid that's being offered. So I was wondering if there was a way to develop a policy or something that could bulk up the infrastructure of that office so that if something like this happens, more people can access that aid. And that's all. Thank you.
Thank you so much, Lisa. That's definitely something that we will consider when working on our policy papers. Thank you so much for sharing that. It's very insightful.
Awesome.
We'll hear now from Grace.
Hello, can everyone hear me?
Yes.
Okay, hi, I'm Grace. I'm a freshman at the Madeira School, which is also where Tarina goes. And one of the things I've really noticed with this pandemic is that people, when there's a problem, people are sort of unwilling to recognize it. Everyone says it's far away, it's not here. And really, that's a significant problem. People need to understand that instead of waiting for the problem to reach them, they need to face it head on. Because when the problem actually reaches people, that can be a catalyst for change, and it can be really eye-opening. And what I'm wondering is how can, in future problems and future crises, how can we sort of start that earlier? How can we have people's eyes opened, really having them work towards fixing the problem instead of waiting for it?
That's a great question. The question, to repeat Grace's question, is how can we start fixing the problem instead of waiting for it and to really start taking action? If any of the directors or any participants want to add on, just let us know in the chat.
Can I reply? This is Mary Beth Connolly.
Yes, ma'am.
Oh, yes, go ahead.
Just a thought on how do we prepare people ahead of time. And it goes back to kind of what I said about Mayor Tarter and Superintendent Noonan, and that is now and going forward, people in leadership really need to cultivate trust. And when there is disagreement among people in leadership, then the community doesn't trust and doesn't believe. Whereas when you have leadership that is that people understand and people believe and people know are trustworthy, then they're much more likely to understand. So all the partisanship that we're dealing with in America, I think that has a lot to do with the fact that people just don't believe and don't want to believe.
Thank you so much for sharing. We're going to hear next from Eleanor Thatcher. We're going to try to get through all these hands. We have a few more minutes left. We might run a little bit over 5:30, so if people have to leave, we completely understand.
After Eleanor, we'll get Charlie.
Hi guys, I'm Ellie. I'm a first year EVA. My biggest concern right now, not my biggest, but one of them is in terms of foster kids. Teachers were like one of the #1 advocates for those students and reporting those students in certain situations. And also being at home might be might be a catalyst for certain things to go down in homes, whether that be with like certain students or even like domestic abuse, who knows. But so my big concern would be with those children and how like we're reaching out to kids, like as with helplines or anything. just to make sure that they know that they have outlets to go to, even though this is like social distancing. It's like, how do we support them with, proper ways? So.
That's an incredible point, how we make sure we have that accessibility and support and connection, and there are resources even in this era. We will 100% take that into account.
Thank you for sharing.
Can I also, I'm so sorry, just because I think it's important, I know we're short on time, but
yeah.
If you're a Fairfax County Public Schools student, whether you're foster care or not, there is a resource now on the website. There's a link. If you have a hard time, feel free to reach out to finding it, where people can sign up for like mental health office hours with different, social workers, psychologists in the school system. Push that out as much as you can. And like I said, feel free to reach out if you can't find it on the website.
Thank you so much for sharing that, Ms. Amish. That's really useful for especially the Fairfax County students. We're going to hear now from Charlie.
All right. Hey, guys. I'm Charlie. I go to George Mason High School. I'm a friend of Coulter's. And I just wanted to shout out the whole Falls Church team for doing everything they're doing. They're really doing great with the communication and all that. So good for them. And then I also wanted to touch on the point that I think with your missions, which are truly honorable and noble, I think there's some overlap for sure between things like education and economics and even health with something like agriculture in a state like Virginia, where agriculture is the largest private sector industry. And I mean, 1.7 jobs for every job in agriculture, 1.7 jobs are tied to it. So there's like huge connections with that. And so right now also, there's a lot of fresh produce that's being destroyed because there's a lack of demand from wholesale buyers like restaurants. And so if there's a way to, and also there's a lot of children that need fresh food that can't necessarily afford it to pursue their educations. So I was wondering if there's a way to connect those two dots and bring that produce to those children and sort of with I don't know, that's my sort of question and proposal.
Yeah, so that question was about connecting the dots between those struggling in agriculture and children who need produce, which is a really incredible point. Thank you so much for sharing. Our next speaker will be Ella.
Hello, there we go.
Hi, I'm Ella. Can you guys see me and hear me okay?
Yeah.
Okay. And I just wanted to touch on the point that someone was talking about students with disabilities. I work very closely with students with disabilities, and what they're putting in place right now, it's called like a temporary learning plan. And so basically case managers for students with disabilities, they will contact like teachers and parents. But I think another big problem is that a lot of students with disabilities, they don't have like good family lives. And like I just know from personal experience, especially at Woodson, like I know a lot of people that they're not in the best like economic status, and they don't have the support from their families, because a lot of these students, they can't just log on to Zoom like we can as high schoolers. They need a caretaker and someone to help them with that. So I think that's just a big problem that a lot of people think that like students with disabilities always have the support and like the backing of their family, but that's just not the case. So yeah.
Absolutely. And for a lot of students with intellectual and developmental disabilities, the time that they're at school is a lot of times the families are working, and now that the students are home full time and they do need a lot of direct care, it can be hard for the parents. So yeah. Thank you so much for sharing. Before we hit the last 4 hands, and if anyone else wants to raise their hand, please do it now. But the people that have their hands raised, please keep them up. We still have 70 people in the call, and we know that we said we'd end at 5:30, so we want to just do our little closing remarks real quick before we can hear you guys. We're going to stay on and hear what you guys have to say. But for the people that have to go, we want to let you leave.
So just really quickly, we want to express how thankful we are for all of you for coming. We want to especially thank you for supporting youth engagement in policy and politics, because we do know that we have such power to make change, but we can only do that if we're all working together. If you want to get involved in the Greater Good Initiative, we are looking for youth research fellows who would essentially be associates that work with our directors to help craft good policies. And just from hearing so many of you here at the town hall, we know you have such incredible ideas. So make sure to contact us.
Absolutely. Along with that, we also would like to onboard some adult mentors that can sort of act as our board of advisors for GGR. We already have some, but we're looking for more adults that are interested in supporting our youth initiative and advise us through the start and just growing our organization. So if either of those, either the youth research fellow position or as onboarding as an adult mentor, if those are appealing to you, please email us at greatergoodinitiative@gmail.com. Additionally, we would love for you guys to follow us on all of our social media. Our Instagram is at The Greater Good Initiative, and our Facebook page is also called The Greater Good Initiative.
And we will find a way to make this, we've been recording it, and we'll make this town hall available to anybody who might want to see it. But we will, Adam, do you have anything else to add before we get back to the questions?
No, just thank you so much. Especially thank you to our policy officials, and our public office holders, and our candidates for Congress. Thank you guys so much for coming. We really appreciate you guys providing your insight, and thank you to everyone that came, because this was, as Tarina said at the beginning, this is something that we had an idea 12 days ago to come up with this organization, and the fact that it's grown so much in such a short amount of time is really, really, really amazing. So thank you guys so much. We're gonna stay on and continue going through these raised hands, and yeah.
Awesome. So we'll take Hannah.
Hang on.
Oh, God. Sorry. I think your mic might not be, do you mind moving your mic closer?
Oh, sorry.
No, you're totally fine. Thank you so much.
Okay. So, can you hear me now? Okay, so I have 2 points. The first one is that it's kind of about the past. So, like currently the US is the #1 country infected with COVID-19, and it's been that way for about a week or two. And I think one of the sole reasons that the US has surged in cases is that the government did not properly prepare and target the correct people and the right workers in the first place. So until the beginning of March, the president has either rejected the fact that the virus was a big deal, or has simply stated that he and other federal leaders had the situation under control. And I know it's not really productive or progressive to linger on the past, but I think that if America had some kind of like conversation about how the US would operate if we were struck by this like beforehand, like a few months ago, we would be much better prepared about it now, and that the economy would benefit a lot more. And then my second point is actually about the exact opposite. It's about reopening. So right now, Wuhan is seeing a decrease in cases, and as a result, there's like many articles that interview people who still live in fear. So I believe that when we reopen places and lower restrictions, it'll still be gradual, and people will not ever live life the same. And I feel that like concert shows and really crowded places will not be present for a long time, which is something we're not really used to yet. So I feel like the thing that Mr. Yates said about how we won't see 2019's low unemployment rate until about 2022 is really true. And I feel like this is a really sensitive time, so we all have to like sympathize for each other, even when we reopen and stuff like that.
Thank you. That point of sympathy and empathy and just showing that kindness to one another, especially when we reopen, is so important, and looking at the past, present, and future. So thank you so much for that. I know we had Mr. Loyola raise his hand, so we'll go ahead and get him, and then Ike is on the docket.
Yes, can you coming through okay?
Yes, sir.
Yeah, I just want to share one of the folks I learned about because the second congressional district is 895,000 people, so you get all sorts of great feedback, great information. Was this AuntBertha.com portal, which is actually a zip code based portal to allow the fusion of all sorts of social services. I had never seen anything like that before, and I think our government, both state, local, federal education system, food, housing, goods, transportation, health, money, all sorts of requirements that individuals have during this crisis. You put in your zip code, and then it gives you a list of all these organizations that are nonprofits or state or federal, right in your backyard. And granted, some folks, especially that during this time of crisis, don't have the internet access or don't have the ability. but we can all be facilitators for those. So if you know someone, like some of the students that came on, they know families that are in need or have a challenge economically, maybe find out what their needs are and do a quick search via this portal, because then you can print out a list of phone numbers and contacts and locations of these offices right in their backyard, which would be a great service to your local community. I heard the thing, and while I share the concerns and the passions, I truly believe that if you look at the per capita incident of what's happening here in America in the COVID virus, the information came out of China is very disturbing, because they kicked out the reporters. You know, we live in America under the First Amendment of free speech, freedom of assembly, all these things, and our great news, so we can have this great social media and exchange ideas of all diversities. But they kicked out the reporters. They kicked out U.S. and international reporters, and right after that, their statistics went like, hey, everything's fine here. No new cases, no deaths, nothing was reported. So you cannot believe, unfortunately, what a communist country it puts out for media. I was born in communist Cuba. I've lived what those regimes will do. So that data cannot be trusted. You know, several billion people in China, and to think they only had 83,000 cases, and the days after they kicked out international reporters and U.S. reporters, and their data went to zero. You just can't buy that information. It's just not valid. Statistically, as an engineer, cannot happen. You know, a bell curve, as we all know, being in the education system, you know what a bell curve looks like? That's real life. That happens in nature, that happens in life, it happens in math and engineering. And their bell curve went up and then went straight down shortly after they kicked everybody out. So you can't believe on that. And our response, you have to look back to it, our incredible technology. To think that in a few weeks, few days, they mapped the genetic code, the DNA of this virus. And now there's over 100 clinical trials, human trials across the world and here in America that are testing a vaccine. Is absolutely a testament to the ingenuity, the entrepreneurship, the abilities of individuals to have a great education and great resources to be able to come back to fruition. That's just going to save incredible number of lives. We live in an amazing era, which was only going to get better through technology. So I have to share on that. And you know, we will learn from this thing. Could we have better? You can always do better, and that's important to do. But I just wanted to share that, because I hear what China's putting out, and you just cannot buy that at all. That government, it's about the collective. They control the message. They control the internet. What we're doing right here, we could not do in China. It's just sad what's going on. So be wary of what you hear. So I want to share that.
Thank you so much. Thank you so much, Mr. Loyola. We'll hear now from EK.
So one particular, so basically, the federal government response to this crisis has been very ineffective. And as a result, you know, state efforts have been very disjointed. You know, some states place, you know, golf courses as not essential and other states do it. And I heard like Florida has like WWE, like as essential workers and stuff. But recently I've heard that like governors in like New York State and all across New England and like California, the Californian governor has announced that he's working with a couple other states on this issue. And sort of these regional partnerships are, you know, growing. And so my question is sort of, could building up of regional partnerships between states sort of, could this help to stop the spread of the coronavirus and sort of help build a better sort of effort against the virus from this like ineffective federal response or, you know, local response?
Yeah, that's an incredible point. It is something for a lot of us to think about how the federal and local responses, there are some discrepancies in how a lot of the times the local response has to close the gaps of the federal response. So that's definitely something that we, as trying to come up with good policy, will 100% have to think about. So we do have 2 more people to hear from. They are directors within GGI. So we will go ahead and get Diana.
Hi, can everyone hear me?
Yes.
So the point that I wanted to bring up, I'm not sure how much it's been discussed tonight because like I haven't heard much about it, but oh, by the way, I'm Diana, Director of Strategic Planning and Public Outreach. So something I wanted to point out was that this crisis has disproportionately affected marginalized communities, specifically Black and Hispanic communities. And it's not only it's not only because it's like a low-income community, it's because of systemic issues that contributed to the rise of these cases. And recently, I noticed that the U.S. Surgeon General released a statement that said that Black and Hispanic Americans should step up and stop using tobacco and drinking alcohol, which isn't necessarily getting to the point of the systemic issues that are an underlying cause of the rise in deaths and cases in these communities. So I read something on social media the other day that I think was really important, and it was from D.L. Hewley, I think, and it said that when you talk about the high rate of COVID deaths in these communities, you can't mention diabetes, asthma, these conditions without also mentioning the systemic issues that led to this, such as poverty, gentrification, healthcare disparities, all these things that are part of these systemic issues. So for me personally, I live in a city in South Florida called Hialeah. It's a city made up of 94% Cuban Americans. My family's Cuban, and we are the second city in South Florida with the most COVID cases. And a lot of people would say that's because it's a low-income community, it's a minority community, but there are also like problems with the policy that the Florida administration and the government itself has put out. I know a family friend that's really close to me was recently in the hospital with COVID, and when she tried to make an appointment with one of the drive-through appointments, like they didn't give her an appointment, they didn't answer the phone. She called like 20 times throughout the week and they didn't pick up the phone because there were so many people calling. And she went to her doctor's office and the doctor gave her some medicine and didn't pick up on the fact that it was COVID and just treated it as a normal cold. And if she would have kept taking that medicine, she probably would have died, if we're being honest. So I think that we have to address the fact that the solutions that people have been putting out for minority communities haven't necessarily been effective. And when we're discussing policy and public health, we should directly advocate for these communities that don't have the same resources, financial resources and otherwise, that other communities may have. That's basically what I want to say. Thank you.
Thank you so much, Diana. You brought up such an important point about how so many of these things are institutionalized. And if we don't get to the root of that as we are thinking about policy, as we're advocating for solutions, we're not going to be able to change things on a grander level. So thank you so much for bringing that really, really important point up.
We're going to hear from Heron now, but also Ms. Omesh put in the chat from the Fairfax County School Board. She said, if anyone has questions for her, feel free to raise your hand and she'd be happy to answer them.
Thank you so much, Ms. Omesh.
Hi. Okay. Hi, I'm Heron. Is my video up? Hi, I'm Heron. I'm one of the directors of educational policy here at GGI. And my point kind of has to go along with what Diana was talking about. So personally, I think around the very start of this outbreak, when schools started to close for us, I did get a little sick. And while my symptoms were kind of tells of the coronavirus, I wasn't able to get tested and my parents didn't find it as significant enough. But it wasn't really a problem until my brother also got sick and my mom also got sick. And while me and my brother are really healthy, we got over the sickness in 3 to 4 days. But my mom, she was dealing with it for 2 weeks and has just now been able to start working again. So I guess one thing that we really do need to concern is the lack of tests that are out there. My parents have gone to my local hospital twice now, and they've rejected her both times to get a test done just because she had to meet 2 out of 5 criteria, which were being an FCPS employee, traveling outside of the country, knowing someone who has the coronavirus, and if she has any other life-threatening diseases. And while I do find that very important, I just don't believe that there should be certain restrictions on who needs to get a test, because my dad has a job where he has to meet new people every single day, and if someone in my household had it, he wouldn't have known like to avoid going out and spreading the disease. So I do believe that there needs to be like policy work, especially in terms of public health, that does address comments such as accessibility and getting access to these tests. So that's all I wanted to say. Thank you so much.
The testing and access to tests is obviously a very important topic and something we can really look into for our public health policy. The last hand we have raised is another one of our directors, Elizabeth Paul. So we're going to unmute her.
You guys hear me?
Yes.
Okay. So kind of going off of what Diana said before, just about how systemic flaws are really showing up during this pandemic, I think another one of the things that we can really see like a minority group really being targeted is incarcerated peoples during this crisis have really been affected far more than the like general population. For example, I think it's Rikers Island. I don't know if I'm saying that right, but it's basically a detention center where a lot of people are detained there, like 7,000 plus, and they've seen a lot of cases there, and it's a very close-knit area. And because of that, something like more than 700 people have tested positive for coronavirus, including employees. And it's just highlights the fact that people that are in jail for nonviolent crimes, are being held there and being who are danger to society. There's been a lot of proposals to allow them to be on probation right now so that they're not at risk for this coronavirus. And especially because we know there are flaws in the criminal justice system, and we know there are people that are incarcerated unfairly and aren't being necessarily given a fair trial before they are sentenced to prison. It's really important for us, I think, to consider what's going on with how they're being treated unfairly in the situation. And also going off of that, people like undocumented immigrants that are being detained by ICE. We've definitely seen a lot of cases being showing up within that population, and that's also something that could easily be prevented right now, especially in a time when we're like in the middle of a global pandemic. Possibly detaining undocumented immigrants isn't the most important thing right now. So I think those are just things that we need to be considering when we talk about policy, is how are people that maybe we don't necessarily think of every single day, how are they being affected by this too?
Thank you so much, Elizabeth. Your comment goes to show just how much everything is connected. This pandemic is touching everything from the criminal justice system to immigration reform. So thank you so much for bringing that up into everybody's attention. Next up, we have Ella and then Catherine.
I just have a quick question. Adam, can you explain, you were talking about the student internship or something?
Oh, the research fellows?
Yeah, that.
Yeah,
Can you explain that?
For Greater Good Initiative, like we said at the beginning, our first project is we're going to try to be releasing policy papers in the 3 sectors of policy regarding education, economic, and public health policy. And so we currently have policy directors. They're all on the call right now, but we are looking for other students and other youth that are interested in public policy and policy writing to get involved in doing the research and helping write and craft these policy proposals. Our ultimate goal is, we want to advocate these policies to local, state, and federal legislators. And at the end of the day, the biggest goal is to get one of them passed into law. But we really want to build our organization. Like we said, we came up with this idea 12 days ago, and we have made big strides since then, building our team already, and we're continuing to build our team and our organization. A lot of us are based in Virginia, most of us based in Northern Virginia, but we are looking to expand. We have people on our team that are from North Carolina, Oregon, New York, Florida, and so we are really looking to build this and make this a nationwide organization and a nationwide movement of youth that are interested in policy and creating active change through policy. And so if you're interested in that, feel free to email us at the Greater Good Initiative just greatergoodinitiative@gmail.com, or reaching out to us on social media at the Greater Good Initiative on Facebook and Instagram. And yeah, we really want to build our team and get more people that are interested in actively writing policy.
I just put
awesome. Thank you.
And if you also are interested, for anybody on the call, if you're interested in the advocacy portion, we are also looking for fellows in the federal and local advocacy portion. So feel free to email. I just put it down below. And now we have Catherine.
Hello. So I just wanted to say, like, everything nowadays is being done on Zoom. And I don't know if there's a lot of studies on this yet, but I think we'll find that a lot of jobs can be done at home. And after this is all over, I think there will be a shift. People will start working from home more, and perhaps office space won't be used as much. And right now, there is so much office space going up in Tyson's Corner, and that right now is really the area of Fairfax County that is growing and expanding exponentially. And I'm just like wondering what policies can be put in place to sustain the growth even after the real estate market, and especially the office space real estate market, is potentially hurt by this. So yeah.
Absolutely, and that's something that I definitely didn't think of, about how more and more people are probably going to be working at home as a result of COVID-19, and that's definitely something that we can look into and do some research on when we are working on our policy papers. And if you're interested in that, like we said, reach out to us, because we love having people that are very passionate about a certain topic and want to do research on that. Here for Faye now. We're going to try to end by 6, everyone, because we know that we said we'd end at 5:30, but we had a lot of people that were interested in speaking. So yes.
Hi, can you hear me now?
Put your mic a little bit closer.
Yeah. Okay, can you hear me now?
Yes.
Okay. So first off, I just wanted to say that I think what we're doing here with the Greater Good Initiative is absolutely incredible, like getting community leaders as well as, the youth together to analyze the situation and like quickly brainstorm solutions that we can possibly apply in real time. And I just had something that I wanted to share with everyone. So my aunt and uncle both work as frontline medical workers in Wuhan hospitals, and I was actually able to hear from them firsthand about how conditions were like over there. And I think one incredible thing that they told me about was that in each of the apartment buildings in their town in Wuhan, the people in the apartment buildings would actually find a way to get everyone in contact with each other through like text or this app called WeChat, and basically they just help each other out like financially, and maybe even get certain people who would volunteer to get groceries for everyone, so that way a limited amount of people would actually be exposed to the external environment. It's basically everyone looking out for each other. So the point I basically wanted to bring up is that I think in a way we should consider how Chinese communities have dealt with this in order to encourage, the people in our own communities to actively help out. And then that way we can ameliorate our current conditions and hopefully in the long run speed up the social, economic, and health recovery.
Thank you so much for sharing that, Faye. That's very, very insightful. Obviously, you have a resource of insight that not a lot of people have. And so we'll definitely look into, take that into consideration when we're working on our public health policy. And again, to all the youth, and especially all the people that spoke today, if you're interested in getting involved with any of our sectors of policy, we would love to onboard you as a research fellow, because we really want strong people that are passionate about what they are passionate about to work with us here at GGI.
So I think with that is all of the questions. Adam and I want to say a huge thank you to those of you who came and obviously are still here. It's so wonderful to be with all of you virtually. These ideas have been incredible, and we can't wait to see how we can transform them into policy.
Ms. Somesh from the Fairfax County School Board just put into the chat, she's been doing calls every Thursday and Sunday with students and health professionals all over Fairfax County. So anyone that is from Fairfax County or Northern Virginia, or really anywhere, because the information can be pertinent to people all over the country. She's doing these streams. She just put the flyer if you want to download that real quick. Hers is tonight at 7 p.m. Thank you so much for staying on so late, Ms. Somesh. We really appreciate it.
I know how busy you are, so thank you so much.
No, of course, happy to, and proud of you guys. So keep up the good work, be in touch, and maybe we'll see you tonight.
Thank you so
All
much.
right. Of
Thank
course.
you so much to everyone who came today. We really, really appreciate it. Again, last time we're going to say it, but if you are interested in getting involved with the Greater Good Initiative, reach out to us by emailing us at greatergoodinitiative@gmail.com. Follow us on Instagram and reach out to us there at the Greater Good Initiative, and our Facebook page is also up, the Greater Good Initiative. Thank you all so much.
It was wonderful seeing you.